Welcome back. It is 8:30 and time for Transparency Tracker. This week, a group digging into government spending is focusing on federal healthcare price transparency rules.
Adam Andrzejewski, the CEO and founder of Open the Books, joins us now live with the breakdown. And Adam, what did you find with this?
So across the country, there's an organization called Patient Rights Advocate, and they audited the top 2,000 nonprofit hospital groups across the country to see if they were being compliant with the new federal healthcare price transparency rules. This was a common sense reform instituted by the Trump administration and carried forth by the Biden administration that simply opens the books for the first time on what hospitals charge patients. Sounds like common sense. This is very popular, and what they found on their audit was 75% of the top 2,000 hospitals were not complying with the rule. Now, we took a look at what they found locally in Portland with the two major nonprofit hospital groups, and they found that they were largely compliant.
Adam, tell us what the federal pricing rule requires of hospitals and how you think most hospitals are falling short.
Well, for instance, when you go to the grocery store to buy milk or bread, you know the price. And before, it just wasn't the same with hospital pricing. But today, you can go to, for instance, Northern Lights right there in Portland, or the Maine Healthcare system right there in Portland, and there's price estimator tools on their website. You can also see their discounted cash prices. You can see their cash prices for services. So, for instance, Northern Lights, there's 10 points on the federal transparency scorecard, and Northern Lights complies on all 10 counts. Maine Health complies on 8 out of 10 counts. So they're pretty good on this. What they're missing is a key components on a file, the standard charge file, and they're also missing their negotiated rates file. So, and that was as of the end of last year. So they could do a little better, but both institutions are doing pretty good. And this is good news for local patients, because before you go in for the services, you can shop prices.
Which is unheard of when it comes to medical places, hospitals. By the way, which local hospitals did you look at? And what did you find? And also, when you followed the money, did these local hospitals profit during the pandemic?
So Northern Lights, they did not profit during the pandemic. In 2019, between 2019 and 2021, the net assets of Northern Lights actually dropped by about $100 million to about $700 million. Maine Health, on the other side, they had a very profitable time during the pandemic. Their net assets went up sharply from 2019 through 2021. They gained about 50% on their net worth, from $1.7 billion up to $2.5 billion. And so, in the local marketplace, we're calling on Maine Health to come into compliance on all 10 of the federal healthcare price transparency rule points on the scorecard. Because you can only imagine, if people are making a decision between the two institutions, they have to have all the information there to make a proper healthcare price transparency decision.
And Adam, did we reach out to the hospitals, and what did they have to say?
So we did. We did not hear back from the hospitals. And look, we wanted to know from Maine Health, why the substantial and sharp increase to the net assets during the pandemic, and why aren't they being compliant on all 10 healthcare points by the end of last year? And do they have plans to come into compliance on that? We did not hear back from them on either on their finances or on their health care price transparency rules instituted locally.
All right, Adam, thank you so much for your time this morning.
Thank you.